Are you struggling with some back pains? Are you having some joints which are aching? And have you been trying to understand where is this problem coming from? Welcome to this episode. I'm going to take you through this. Your burdens are going to be relieved. Welcome. Stay tuned. Okay, I have Gideon is here with us. It will be going to take us through this. Any problems you have been having with your back pains and maybe with some nerves, welcome, and let you go through with me until the end of this episode. And I am sure that all these your problems will be solved. And I'm sure you are going to do whatever he tells us to do so that you are no longer going to get these kind of problems. Welcome. So, Mr. Gideon,
Thank you.
welcome. And can you just tell my viewers on maybe someone has some back pains and this pain is hammer, maybe moving from top to bottom, or can you tell us what we are supposed to do? Because I've encountered so many viewers of me texting me and telling me, Linda, I have had this some problems, so what can I do to this? Can you tell us what we are
Yeah,
supposed to do?
thank you very much. You mentioned about pain which is radiating or pain which is moving from one place to
Yes,
another.
yes, yes.
It's very key to identify that. Once you identify your pain is it was somewhere and they are shifted to somewhere else, the high time for you to go for a review, especially to a doctor or a physiotherapist. Orthopedic doctor will be able to identify this and help you. Mainly, you notice pain might be radiating pain because of a nerve impingement or a muscle imbalance, which is mainly because of muscle tightness. Um, yeah, for sure, many people they react to this pain. They get this pain because of what they do, especially when you overuse a certain type, a certain muscle, it will present with tightness. Everything is prone of getting tired. Like for instance, you're a school teacher and always you're just writing on the board repeatedly from 8 to 5. So considering how what this hand has been doing, comparing to the other side, you definitely get an overuse on one side, and your body will try to tell you this is not how I'm made, this is not how God created me. So it will react by telling you, please cheza chini, pause, nimechoka.
Okay, thank you, Gideon. Now we have come to know some problems, maybe some causes of our problem. For example, that school teacher who is obviously using this hand and he gets some pains here. So, what can you tell a viewer who is having that kind of a problem? Now he has known the cause of this problem. How can you just advise this viewer who is having that problem on the pain?
Yeah, the first thing you need to do is you have to go for muscle relaxation. And before we relax muscle, we have to identify whether you pain had maybe for a person who has stayed with his pain for 1 week, you can't expect the muscle to be the same to a person who has had the pain for a month or for years. A person who have had it for many years, you find one muscle will affect another, and it will be a compartment or a group of muscle which have gotten the issue. And the person who has just got the pain who is in acute stage, you notice the management is different from a person who has had it for long. So I'll tell this person it's good for you to go for a physio. Physio will release the muscle manually and will identify if it's a certain type of muscle. The first thing we normally recommend is you can take, if the pain is in acute stage, like you can't do anything um, without you getting pain down, we recommend a muscle relaxant. We have MR medications, we have Zulu, we have Myospaz, we have different types of medication which we normally give a person. But if this muscle relaxant doesn't respond quickly, we recommend a physio session for a physio will be able to bring this muscle to normal function and help it to get to the normal function effectively. So I'll tell this person it's very good for you to go for an assessment and you get treated.
Okay, thank you. My viewer, if your question has not been answered, feel free to text us, write a message, just and send it to us. We will be able to respond to you, and we are going to give you further information on either which side you feel that you have some pains, or where you need us to help you. If you have some questions, feel free to write us a message, and we are going to come back to you. Now again, Mr. Gideon, I want you to help our viewer know on if they have used that. You have recommended some solutions to some pains. So if they have visited the medic, or for example, if they have just gone to take the relaxers, the so if they have gone to take that medication by themselves, can you recommend them to see a physio, or I can just, if it's my mother, I can just go and relax the muscles? Is that recommendable? Just
No,
tell
no,
the
no.
viewers.
No, you have to understand before you go for the Kenyeji way, there is a professional way to handle pain.
Okay.
Pain doesn't come willingly. Like you can't choose in the morning, I'm going to have backache. You know,
Yeah, yeah,
you
yeah.
can't choose
You
pain.
can't choose anyone.
Yeah, and that's why we normally say these are things where we have professionals who have been trained on how to manage this without side effect. You notice there are many people who they will have pain and they thought of maybe I should go for a Kenyaji massage to relieve my back pain. I tell you for sure, these people they don't get a permanent solution. Person is just going there, you just get a covering to relax, but you'll find you're not treated. That's not treatment. That's a session for you to just feel nice and it's psychological therapy.
Yeah.
But when you go for a physiotherapy session, you get 100% assurance of your pain getting rid of. It can take time, but we normally tell you you can know this one after the first assessment. Once you identify you have any musculoskeletal pain, musculoskeletal, we just want to tell you, is a pain around a joint, is a pain you feel it alongside a bone, is a pain you feel it alongside your body. We normally tell you it could be a pain which has been there for the last 24 hours, or it's a pain which has been there for months, for weeks, or for years. You have to go for a physiotherapy assessment and treatment. It's very good for you to consider this. Now, a physiotherapist maybe it's a pain which is beyond their 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 range, like their bone deformities or joint deformities with people that have carried along for years. Now we call for other specialists who can help us to maybe align this bone or help us to reconstruct. Now we call for the chiropractors or we call for orthopedic surgery. Yes.
Okay. I see my time is up. And are you there struggling with some pains? And do you need some solutions? Kindly let us know by writing to us, and we will respond to you quickly. Thank you for your time. Thank you for listening. Inshallah.